Carbohydrates have long been considered a dietary essential, providing a quick and efficient source of energy for the body. However, when consumed in excess, particularly in the form of refined starches like white bread, pasta, white rice, and processed snacks, carbohydrates can become a major liability to metabolic health. One of the most serious and often silent consequences of chronic high-starch intake is the increased risk of developing type 2 diabetes. This condition doesn't emerge overnight. Rather, it builds slowly, over years or even decades, as the body's systems become overwhelmed by repeated surges of glucose and insulin. For those who rely heavily on carbohydrate-rich diets, especially ones dominated by low-fiber, high-glycemic starches, the risk is not only real, it's steadily rising. Every time a carbohydrate-rich meal is consumed, blood sugar rises as the food is broken down into glucose. In response, the pancreas secretes insulin, a hormone that facilitates the transport of glucose into cells for use or storage. In the short term, this system works well. But over time, if large amounts of carbs are consumed regularly, especially those that are quickly absorbed due to a lack of fiber, the body is forced to produce more and more insulin to maintain stable blood sugar levels. Eventually, cells begin to respond less effectively to insulin signals, a condition known as insulin resistance. At this point, even more insulin is required to achieve the same effect, placing enormous strain on the pancreas and leading to persistently elevated blood glucose levels. This underlying dysfunction is the foundation of type 2 diabetes. And contrary to popular belief, it can begin developing in people who aren't visibly overweight and who may not experience any clear symptoms. What often starts as occasional fatigue after meals, subtle weight gain around the midsection, or rising fasting blood glucose can quietly evolve into full-blown metabolic disease. Unfortunately, by the time type 2 diabetes is formally diagnosed, the body may already have endured years of insulin resistance, pancreatic stress, and low-grade inflammation, all largely driven by excessive refined carbohydrate intake. The type of carbohydrate matters tremendously. Whole food sources like legumes, non-starchy vegetables, and intact whole grains are digested more slowly and contain fiber that helps modulate the release of glucose into the bloodstream. Refined starches, on the other hand, are rapidly digested and absorbed, mimicking the blood sugar effects of pure sugar. These include white rice, regular pasta, baked goods, instant cereals, and nearly all ultra-processed snack foods. They provide little satiety, often lack any meaningful micronutrients, and trigger a disproportionately strong insulin response. It's these kinds of foods that dominate many modern diets and quietly push individuals toward the diabetic threshold. High-starch diets also indirectly contribute to the development of fatty liver disease, another major risk factor for insulin resistance and diabetes. When glucose from excess carbohydrates is not needed for immediate energy, it is converted into fat in the liver, a process known as de novo lipogenesis. Over time, this contributes to the accumulation of liver fat, which interferes with normal insulin function and disrupts blood sugar regulation further. This mechanism helps explain why even non-obese individuals who consume too many refined carbohydrates may still face high risks of metabolic dysfunction and type 2 diabetes. The body's ability to manage carbohydrates effectively also declines with age. As people enter middle age and beyond, insulin sensitivity naturally decreases, making high-carb diets even more hazardous. What was once manageable in a person's 20s or 30s may become metabolically destabilizing in their 40s and 50s. For many, this change goes unnoticed until blood tests begin to show prediabetic markers, such as elevated fasting glucose or HbA1c. These warning signs, if ignored, frequently progress to full diabetes, accompanied by a lifetime of complications including nerve damage, kidney disease, impaired circulation, and vision loss. The social normalization of high-starch meals only deepens the danger. From breakfast cereals and sandwiches to pasta dinners and sugary desserts, the modern eating pattern is deeply carb-centric. Even foods that appear healthy or low-fat are often loaded with hidden starches, especially when processed. This makes it easy to underestimate carbohydrate intake while gradually pushing the body toward chronic insulin overload. And unlike other health conditions, the progression to type 2 diabetes can be insidious. Many people continue eating the same way for years without realizing the damage until it's too late. Reducing diabetes risk requires more than just cutting sugar. It means rethinking how carbohydrates function in the body and recognizing the metabolic burden that high-starch diets impose. Without moderation and careful food choices, the regular intake of refined carbs doesn't simply cause temporary energy crashes. It lays the groundwork for permanent dysfunction. Type 2 diabetes is not an inevitable outcome, but it is a predictable one when the body is continually flooded with starch and forced into a cycle of overproduction, resistance, and eventual collapse. To avoid this fate, it is crucial to shift away from refined starches and toward nutrient-dense, fiber-rich alternatives that support long-term blood sugar control and metabolic health. Ignoring this connection means accepting the risk of a disease that is largely preventable, but only if the warning signs are heeded in time.